Hello, I'm Stephen Roy Goodman, host of Higher Education Today, a production of the University of the District of Columbia. Welcome back to your education program, the program that connects you to contemporary issues, people, institutions, and organizations involved in the business of higher education in our nation and the world. Today, we'll be talking about how to prepare for various health careers. My guests are two experts who, in different ways, specialize in access to medical education. Dr. Yolanda Haywood is a dean, medical doctor, and professor at the George Washington University. She has written 11 papers in referenced medical journals and was awarded the Humanism in Medicine Award by George Washington School of Medicine and Health Sciences. Henrine Tobias is the project director for a multidisciplinary health careers website called explorehealthcareers.org. Her Career Explorer site is designed to address workplace shortages in various areas of healthcare. She received her master's in education from Columbia University. Welcome to both of you.
Thank you.
And thanks again for being here.
Sure, my pleasure.
Well, if I could start with you, Dr. Haywood, if you wouldn't mind saying something about your background, because I know that you were a physician assistant before you became a medical doctor. Why did you do it, and how was that transition?
Okay. I was born and raised in Washington, D.C., and had the desire to be a physician, but I had 3 children during college and thought that going to medical school would be way too difficult, and learned about a career as a physician's assistant and went to school to become a physician's assistant. I finished that program way back in 1981, and at that time, physicians didn't know what to do with mid-level practitioners, and I found the position actually quite frustrating. And at that time, I decided that 3 kids or not, I was going to medical school.
Fair enough. And what was the thing that was frustrating about your position?
I think physicians didn't know, again, what to do with mid-level practitioners. We were supposed to be able to see all kinds of patients and take care of primary care problems, but physicians hadn't worked with physician's assistants the way they have today. In today's world, everyone knows what a PA is, a physician's assistant. And physicians are very familiar with that scope of practice, and it's a great job. I think if I was doing it today and I was a physician's assistant, I would be perfectly happy. But in the world of 1981, it wasn't even certain that mid-level practitioners like physician's assistants would survive the healthcare crisis. So I was concerned about my employability.
Fair enough. And speaking of employability, Henrine, if I can ask you,
sure.
I know you run a website called explorehealthcareers.org, and
yes.
Perhaps in a moment you can explain a little bit more about the site. But one of the things from what my research has shown, that your site is very good about taking different segments of the health field, the health sector, and explaining to people what they would need to be a doctor, what they would need to be a dentist, what they would need to do to be a physician's assistant. Maybe
Exactly.
you could speak to this point if you wouldn't mind.
Sure. Explore Health Careers is a free, objective resource on over 120 health careers, and we include information such as working conditions, academic requirements, scope of practice, and then we also have extensive links to national associations and accrediting bodies to help students, parents, and teachers decide what the best career is for them.
But let's go back to, let's pretend we were advising, or your site was providing advice to Dr. Haywood back in the day. What would she have found on that site to help her with that transition from being a physician's assistant to a doctor?
Well, she may have started out reading a description about a physician assistant and the scope of practice, and then there's a little section on there called academic preparation, and it would tell her what kind of courses she would need. But then the message for the website is that you can go as far as you can in your career. So there are many different entry points. People start out as a physician assistant or a nurse and move into becoming a physician or other healthcare practitioner. And right now there's a great article on the website encouraging high school students to take as many as 4 years of math and science at that level. And there's a great academic pathways that shows all the different pathways you can take in a particular career. And so we encourage students to go as far as they can in their career, but we provide information on all different levels.
And so maybe if we can talk about some of these levels. So let's say I'm a high school student or a college student. I'm thinking about possibly entering the medical arena in some way. How do I start? I mean, do I just guess, or where do I start in terms of my search?
Well, one part is doing exploration, which is what Explore Careers is all about, and that's reading through the material and the information. And then what I suggest when I talk to students is to actually meet with a healthcare professional. Do some job shadowing, go to a hospital or a physician or dentist's office, see what they actually do, observe how they spend their day. And then internships are a great opportunity for them to receive additional exposure. Then there are many different assessment tests that they can take to determine what health career is best for them. But I often say that it's really up to the individual to choose the best career, and just making informed career decisions based on accurate information is really critical.
And what happens though if let's pretend we're advising the doctor in the day, Dr. Haywood in the day, and let's assume that she's got these 3 kids, and I assume coming with those 3 kids come financial responsibility and other things. Is there a way to kind of assess whether or not it's worth the money to go to the next rung, as it were, in the medical arena? I
think, to be honest with you, that's an individual choice that everyone has to make. The farther you go in your education, for example, a 4-year medical degree or a dental degree, there is more debt incurred through that process. And you have to decide, is this something you really feel passionate about? Do you really want to do this? Most often, healthcare professionals can pay back their loans, and there are many different types of support programs to help them do that. So it's an individual choice, and they would have to make that decision themselves.
Okay, fair enough. And Dr. Haywood, I assume you did make this decision.
I did.
Right. And so did you incur some debt when you
Absolutely.
And you don't regret it? You do regret it?
No regrets at all. I would do it again.
And you would advise some students watching this show and prospective medical students that it's worth the risk?
I would say it's an investment in your career. If I agree absolutely with what's been said. If you are passionate about a career and you have done your homework and feel certain that it's a career that you're going to wake up every morning, well, most every morning, and be happy to go to work, it's absolutely worth it. It's the same investment people make who want to own a franchise. They have to put up money.
Fair enough. Well, you mentioned the issue about waking up in the morning. As someone who's not in the medical field, but who's someone who has gone to the doctor from time to time, I often worry as a patient, has the doctor gotten any sleep? And maybe if you could talk a little bit about, how does George Washington University hospital work? I mean, I know there are doctors in training. Do they get sleep? And what kind of care does a patient get when they go to George Washington?
Okay. Well, if you're going to an academic center where there are trainees, there are different levels of trainees. There are medical students who are, of course, not physicians yet. And then there are interns. Internship is the first year after completion of medical school. Many of us have abandoned the use of the term intern because most of your postgraduate training is just called residency. Right. So some people would say first year resident, that equals internship. So they're medical students and they're residents. Residency training now is very well regulated in terms of duty hours. Residents may not spend more than 80 hours a week working in their training. Now you may say 80 hours doesn't sound like...
I was about to say 80 hours, really?
80 hours sounds like a long time, but when I was training there were no regulations regarding the amount of time that one might spend in the hospital, and most of us remember spending more than 100 hours a week in the hospital working. So now there are regulations, 80 hours a week. Also, trainees must have 1 day off in 7, completely off with no responsibilities for patient care. And you may not work more than 24 consecutive hours. Again, working 24 consecutive hours is a lot of work, and yes, you're tired. But fortunately now we do have some regulation by the accrediting bodies to ensure that trainees are not working long hours that become dangerous both for themselves and for patients.
If you don't mind me pressing you on this point
Sure,
a little bit, because that sounds like a lot of hours to me. And so, as a patient or someone who potentially could be a patient,
right.
So you're saying that I could potentially see a doctor who's been going for 23 straight hours and who's 1 hour away from taking that break.
Yes, that's true. You potentially could. It is true. In a teaching institution, you could see a trainee who, by the way, is being supervised by an attending physician. So your care wouldn't be solely up to someone who's 23 hours into their 24 hours of work.
So then essentially there are two medical professionals who are in the room examining me at that point, the medical doctor and then the person who is the resident.
Correct.
And then, but there also might be a physician assistant or somebody else in the room.
There may be a physician's assistant or a physician's assistant student or medical student. You may have all of those, or nursing student for that matter.
So there are checks and balances here, because it's not just one person who's coming in to see you.
Many checks and balances in the system. And remember, the attending physician is not necessarily the one who may have the answer. We've often had medical students come up with answers for our patients. So I think it's a win-win situation. You have trainees who are thinking along with those of us who are supervising.
And you advise a lot of students in your job as a dean.
It's true.
Okay, and so what are some of the things that are concerning the medical students these days who you're chatting with, behind closed doors?
I think their primary concern is how to study the volume of information that's coming at them. Remember, I mean, in 2010, the amount of knowledge that there is around the healthcare field is tremendous. And so the students are burdened with trying to figure out, how am I going to learn all of this information? I think that's their primary concern. Secondarily, for the students that I advise, they are trying to figure out where they fit in terms of their specialty choices. You know, should I be a pediatrician or a neurosurgeon? Mm-hmm. And so I think those two concerns take precedence in their minds.
And will they talk to you privately about this, or will they go to a site, like we're talking about today?
They will do both. There are sites where they can inquire about all different aspects of different specialties. They come and talk to me and my colleagues about specialties. We, of course, do specialty fairs and have physicians from all different specialties come and talk with our students. So they have plenty of opportunities, yet I think it is a very difficult choice for them.
And to play off that choice, which I could see how that is a tough choice for them, but Henrine, if you could speak to the issue of, let's assume I'm a medical student, I'm now going through these choices, I've got to juggle, if I'm understanding this correctly, how much risk I'm going to take in terms of being successful in that medical career, how much work I want to put into it, what my pay is going to be, what my likely pay is going to be, and how much, and whether or not I'm even going to be good at it. And how do you advise people about that?
Well, I think that those kinds of decisions should be made before you actually enter medical school. I think it's a process that begins very early on, and the more exposure you have to the field, the more people you talk to in the field, the better your informed decision will be. As to whether you're going to be good at it, it takes a lot of hard work. And there is a system in place to make sure you're good at it, because lives are at stake. Right. So it really begins very early in the exploration process.
Well, what are some of those rewards, though, that you get? I mean, we know how hard it is, but what are some of the rewards for going through? And I know on your site you've got dozens and dozens and dozens of careers. What are, if you don't mind picking 2 or 3 of them and maybe talking about what you think are some of the rewards, as someone watching this today would say, I never thought about that. That would be an interesting career. I'd be interested in maybe exploring that. And here are the rewards that I would get in that career.
Well, actually, the top 3 most frequently searched careers on our site are nursing, public health, and physician assistant, actually. And nursing is a wonderful career to go into, and there are severe shortages, as you know, in the profession. It's an opportunity for students to give back, in many cases to have job security, to provide community service, to save a life. And so it's enormously rewarding on a personal level. And many of the students I work with also want to be seen as a role model, and they want to give back as a mentor. So they want to go back to their own communities, and their parents and family members become proud of them.